My name is Anushka Agarwal,
And I am Madison Burke.
and we are from Dulles High School in Sugar Land. Our project allows patients to conduct a self-performed test which analyzes the morphological features of a patient's blood sample using AI to determine probability of leukemia.
Every 9 minutes, one person in the U.S. dies from leukemia, a blood-related cancer that causes about 57,750 deaths in the U.S. each year. From 12.5 years at the onset of leukemia, life expectancy drastically decreases to only 1.5 years at stages 3 and 4. By diagnosing leukemia early, patients can opt for safer treatments to increase survival rate. Restrictions hinder the patient's inclination to visit a doctor, including fear, economic concerns, or not finding enough time. Our project uses an accessible test to address this problem.
So white blood cells like granulocytes, lymphocytes, and monocytes are crucial to our immune system. Myeloblasts are the progenitor cells of granulocytes that differentiate into neutrophils, eosinophils, and basophils. Malfunction causes the accumulation of myelocytes in the peripheral blood that contributes to acute myeloid leukemia, or AML, that causes hematopoietic failure and anemic conditions. Similarly, lymphoblasts differentiate into T and B lymphocytes. Malfunction contributes to an overproduction of lymphoblasts in the bone marrow that leads to acute lymphoblastic leukemia, or ALL, that causes hematopoietic failure and infections like pneumonia.
So, AML and ALL differ from normal cells in the size of the cell itself, the presence and frequency of our rods and granules, and the size of the nucleus in relation to the cytoplasm, which are all significant indicators of leukemic cells.
The first step in our 4-step process to develop our tool is the creation of a microscope full lens attachment that allows the user to take a clear image of a blood smear compatible with the AI. We designed a 3D printed phone attachment that can hold a slide and microscope phone lens in place. Using a convex lens that points all of the light to a specific focal point in order to achieve sufficient magnification of at least 400 times, our design has an advantage over a traditional microscope due to its ease of use.
The first image was taken with our microscope lens paired with our phone attachment, and the second image was taken with a microscope. As you can see in these images, no major differences in clarity or quality were perceived between the microscope lens and the traditional microscope. This means that the phone attachment was as effective in recording the details of the blood slide and provided a more efficient and accessible alternative.
The second and third steps of our process were the segmentation and interpretation done by our algorithm. First, the program thresholded the image into black and white and then located the centers of different cells to identify the outline using the watershed algorithm. To analyze each of these images, the AI outlined the cell using contours, then calculated the best fit ellipse to determine its features like perimeter and area, and also found the best fit rectangle to separate each of the cells into individual files that increase the volume of data.
The algorithm was trained using 200 assorted images of AML-affected, ALL-affected, and normal blood samples. To test the algorithm, another set of 500 images was used. The graphs demonstrate that the accuracy of the algorithm has increased over time, and although it identifies more false positives than false negatives, it is able to accurately classify the data about 81% of the time.
The last step of the process is the app. Once the user signs in, they have access to uploading an image and viewing the prediction that the algorithm calculates. This image is then saved to the device for future reference by the user to further track the progression of the disease.
To test this app, we sent out a survey to a focus group of 39 people. They rated our app on usability, speed, functionality, advantage over alternatives, and efficiency on a scale from 1 to 10. The graphs show that the results were fairly positive, with an overall average of 8.549. Based on this, we concluded that our app could provide an early and reliable leukemia diagnosis.
Our project delivers an accessible method of self-diagnosing leukemia using a cost-effective process of capturing an image of a blood smear at microscopic magnification, an AI algorithm that predicts whether the user has leukemia, and an application that connects both of these components to facilitate patient experience. Thank you for your time.